Hello everyone. Today I am going to do a presentation on public health systems. We're going to talk about management in public health systems as well as the impact on public health and the community. I'm Brian Heil and I am the Health Promotion Coordinator at Defiance County Health Department. So let's get started. We conducted a workforce development survey in 2022, going into 2023, to look at skills that needed to be developed at Defiance County Public Health. So one of the domains is management and finance skills, one of the core competencies, I should say. And so based on that survey, some of the things that were identified as opportunities for improvement we're describing the differences between local, state, and federal public health systems. That's the tan color. And the other item in this competency is describing the organizational structures, functions, and authorities of local, state, and federal public health agencies. So you can see that over half of staff respondents indicated that they were novice or between novice and competent in these areas. So that's why we chose this as one of the areas to look at for workforce development in 2023. This slide here just shows some basic functions at the different levels of public health agencies. And so we can see on a national or federal level, public health is responsible for assessment, policymaking, resource development, and financing. At the state level, so Ohio Department of Health, they oversee public health in any given state, provides oversight to local health departments, is often a funding source for local health departments, and sets laws and regulations which govern local health departments. At a local level, so our agency, responsible for implementing those state laws and regulations, performs community public health services, is community driven, and local health department employees are the boots in the ground. So they're the ones that are out there in the community doing things to improve population health. When we look at the structure of local health departments or health departments at the local, state, and federal level, at a federal level, it really does start with the President of the United States. The President appoints a Secretary of Health and Human Services, also appoints an Assistant Secretary to the Department of Health and Human Services. That assistant is then the head of the U.S. Public Health Service. Also employed under that is the Surgeon General. There are many different agencies within the U.S. Public Health Services. Some of these you've definitely heard of. This would include the CDC, the National Institute of Health, the FDA or the Food and Drug Administration, the Office of Health Resources and Services Administration, the Alcohol, Drug Abuse, and Mental Health Administration, the Agency for Toxic Substances and Disease, and many other agencies and offices that relate and that the assistant for the Secretary of Health and Human Services is responsible for, such as the Office of Health Promotion and Disease Prevention, the Office of Planning and Evaluation. These offices are all concerned with management, health policy, research, and statistics. At a state level, Ohio is a decentralized public health system. This means that each local health department retains its authority. They are managed by both federal and state grants. And in the state of Ohio, we have 88 counties. But in these 88 counties, there's a total of 113 local health departments. That's because some counties or some jurisdictions have city health agencies, combined general health districts, and their local county health departments. So because we're decentralized and based on population, there are more local health departments than there are counties in Ohio. At a local level, getting into a little bit more details, again, local level program development and implementation, we're governed by the rules and regulations in both the Ohio Revised Code and the Ohio Administrative Code. We are led by a health commissioner, which is governed in our agency by a Board of Health. The Board of Health is appointed by District Advisory Council, which is made up of elected officials in our county. And those elected officials that make up the District Advisory Council, ultimately they are elected by the voters in the county. So really getting down into the weeds, looking at some program-specific things for each of these levels. This slide is showing some of the specific roles and responsibility at the different levels of government. So just quickly here, we think again of the big federal agencies such as HHS. There's 12 operating divisions, which I mentioned earlier. This federal level, again, responsible for contracts, grant administration, and development of state and local contracts. State public health agencies are responsible for licensure of health care professionals as well as inspection of these facilities. They collect vital statistics, conduct epidemiologic studies, manage crisis and disease outbreaks, are responsible for disease registries. They provide laboratory services. So at Defiance County, we do not have a lab. A lot of our lab services are contracted out to the Ohio Department of Health. At a state level, they're also responsible for implementation and analysis of policies, as well as providing guidance on community health education. At a local level, we provide adult and children immunizations, conduct local communicable disease surveillance, so tracking outbreaks in the county and in the community, tuberculosis screenings and treatments, environmental surveillance, population nutrition services, so this would include like WIC services and MyPlate, responsible for local daycare center inspections, conducting health disparity activities, food safety education, and health education and promotion. So a couple on here may not be provided at each county health department in the state. Some things may be contracted out to different agencies. Again, it just depends on that decentralized infrastructure to where some counties may be providing services or contracting them out to other agencies. For example, in Defiance County, at our health department, we do not have Help Me Grow staff, but that's contracted out to Help Me Grow staff at Henry County, who provides those services to local counties within our region. This graphic here is showing just the web, if you will, of the different agencies that are all involved in the public health system. So a lot of times if you hear public health system, you may just think health department, but it really is more than that. With the public health department at the center of this web, we can see all of the different agencies that are involved in the public health system. So a public health system is defined as all public, private, and voluntary entities that contribute to the delivery of essential public health services within a jurisdiction. When we did this at Workforce Development Day, we took some time and just had staff say and write down whether or not they'd been involved with any of these different agencies. When our time was done, I think that we had all of the different agencies circled on this chart. Maybe not everyone has experienced or worked with each of these agencies, but when we looked at all staff as a whole, we found that really everyone had worked with or interacted with one of these agencies in one way or another. So it just goes to show how complex a local health department or a local public health system is, and how it really does take a village to improve population health in our community. The second half of the presentation is going to look at another core competency, which is leadership and system thinking skills. One of the questions within this competency was whether or not staff is able to describe the impact of changes in the public health system on organizational practices in our agency. So the public health system, which we just learned about, has changed over time. And so the second half of the presentation is going to look at some of those changes and how that impacts our community. And this core competency, again, over 50% of staff responded that they were either novice or between novice and competent. And so this was a good area to focus on for developing our workforce. This is a great graphic which illustrates some of the changes in public health really over the last 200 years. So when we look at Public Health 1.0, this is what really improved the average length of life for humans as we know it. So this dealt a lot with growth and knowledge of tools in both medicine and public health. This goes back to basic sanitary conditions, so cleaning and disinfecting to prevent the spread of disease or contraction of illness. At this time, though, there was uneven access to care, and so as we move forward and looking at Public Health 2.0, really in the mid-late 1900s, this looked at development of public health as an agency and the capacity to provide that across the United States. So in the late 1800s, maybe health services were not as accessible, and in the 1900s, moving forward into the 20th century or through the 20th century, looked at improving access to some of those things, focused on traditional public health agency programs. When we look at the early 2000s, the Affordable Care Act came into play. This looked really at, and moving forward is looking at, engaging multiple sectors and community partners to generate impact on population health. This is looking at improving social determinants of health, which are those underlying conditions. So kind of as a recap, during the second half of the 1900s, public health was influenced by a report which found that public health authorities were unprepared to address chronic diseases and new threats such as HIV and AIDS. During this time, public health agencies became increasingly professionalized, building in that infrastructure throughout the country, the states, and to local health departments. Some stressors on public health led to the development of Public Health 3.0 model, which serves as public health employees being leaders in the community, partnering with multiple sectors in the community, and using data and resources to address social, environmental, and economic conditions and to improve health and health equity in the community. So Public Health 3.0 is again looking at local communities to lead change, using multi-sector collaboration and using innovative, or I should say, being innovative and using data and metrics to apply for grants, to secure funding, and to approve different maybe disparities that are going on in the community. This goes beyond traditional public health department functions. This cross-sector collaboration is built into this foundation. There are some recommendations for public health departments and looking at Public Health 3.0 and moving forward. So first is leadership and workforce. This means working with all relevant partners so we can drive initiatives and look at how we can improve workforce to improve those conditions in our community. Strategic partnerships. Public health departments should engage with community stakeholders from both public and private sectors. Doing this helps to form a vibrant, structured, and cross-sector partnerships, which can be designed to develop services, funding, relationships, and governing to improve population health. The next recommendation is looking at infrastructure and accreditation. Public health accreditation is something that some states require, such as Ohio, and other states are jumping on board. But this is facilitated by the Public Health Accreditation Board, and this is a process for departments to basically enhance the work that they're already doing, striving to ensure that every person in the United States, in Ohio, and Defiance County is served by nationally accredited health departments. So this builds some consistency and unity in the way that services are provided. And FAB, or the Public Health Accreditation Board, comes out with standards and measures which health departments have to meet to make sure that they're providing these services in an equitable way for their community. The next recommendation is timely and actionable data and metrics. This is looking at really data on a granular level, so looking at zip code data, even address data, to look at how community members, residents in our community are impacted and how maybe services different things are being provided to them, or do they have access to some of these services? You know, if their neighborhood needs some improvements, what can be done to improve these different conditions across the county? This data should be used to guide and focus different initiatives in the county, including in targeting social determinants of health to increase these different things. The last recommendation is providing sustainable and flexible funding for local health departments. So this funding needs to be enhanced. It recommends looking at innovative funding models and exploring those, thinking of ways to build up leadership and different prevention initiatives, looking at funding from multiple sources, including reinvestment of maybe already generated revenue, and how can that be used to improve programs and services, looking at the core infrastructure, and looking at community level work, again, in addressing those social determinants of health. This next model here shows essential public health services. And so on the left side of the screen, we can see the previous model, which has system management and research at the core. So some of the three main functions of public health have been and continue to be assessment, policy development, and assurance. And so as we look through this wheel and looking at assessment, this includes monitoring and diagnosing conditions in the community. And then what does that do? So that leads to policy development. So looking at the data then to inform, educate, and empower, it can mobilize community partnerships, policies are developed, and then we look at assurance. So after we've developed these policies, we've implemented programs and services, public health is working in our community, we look at, okay, are these things working? This is the enforcement of laws, assurance of competent workforces, and then evaluating. And as this continues, it's just a constant cycle. And so if we evaluate, things aren't working so well, and that leads to more, that's more assessment, that leads to maybe development of more policies and looking at what needs to change to improve these things in our community. So looking at the right side of the screen then, in 2020, this model was evaluated and it moved equity to the core. So research is still important, it's still a part of these essential public health services and these core functions, but really it's just digging down, making sure that these things are all provided in an equitable way to all people, regardless of where they came from and regardless of those social determinants of health. So the things that are impacting their health, we need to address those things to ensure that these are provided in an equitable way. Just quickly from the CDC, looking at this framework, says the 10 essential public health services. The purpose of that framework is to protect and promote health of all people in all communities. So again, looking at equity at the core there. And to achieve equity, these essential public health services actively promotes policies, systems, and community conditions which help to improve health for all people. It addresses structural barriers, removing any systematic or structural barriers that are in place that maybe have resulted in health inequities. Some of these barriers could include poverty, racism, gender discrimination, and other forms of oppression. Everyone should have a fair and just opportunity to achieve optimal health and well-being. So I've mentioned social determinants of health a couple of times. This here shows the different domains for social determinants of health. So we see healthcare access and quality, neighborhood and built environment, social and community context, economic stability, and education, access, and quality. With equity at the center of the essential public health services framework, our previous slide, addressing social determinants of health really is a core function of that, as having equity in the center of that framework. Social determinants of health, again, these are the conditions and the environments where people are born, they live, they learn, they work, they play, worship, and age, and these affect a wide range of health functioning quality of life outcomes. Okay, on this slide, we're going to watch a 10-minute video. This video talks about Public Health 3.0. It talks about social determinants of health and how addressing social determinants of health improves health in the community.
Hello, I'm Dr. John Iskander. Welcome to CDC Beyond the Data. I'm here today with Dr. Karen DeSalvo, Acting Assistant Secretary for Health and one of our most visionary contemporary public health leaders. Welcome, Dr. DeSalvo.
Thank you, John. It's great to be here.
We heard during today's grand rounds about your experience as Health Commissioner of New Orleans, a city where we both did some of our training. What were the lessons there, particularly with regard to this idea of health in all policies?
Well, initially was a very strong awakening that to get to health would take more than health care, that just rebuilding our healthcare system after flooding was going to, as the data would say, make a difference in 10, maybe 20% of the health of an extremely unhealthy population. And really our determinants of health were broader. They were about poverty and public safety and even transportation. And we learned, for example, that the bus routes in the city of New Orleans were essentially all designed to bring people to the emergency room or clinics at Charity Hospital and not really distributing that to an opportunity to go to the community health centers. So there were a lot of ways that we had to re-engineer all of our systems, not just healthcare and public health, but all the other sectors so that we could begin to make advancements broadly in the health of our community.
And I think another insight there was about public health being, I used to think you meant metaphorically at the table, but you really meant literally at the table. So what was that experience like as New Orleans' first ever health commissioner following Hurricane Katrina?
There were a lot of tables that were sat to think about rebuilding our community, and we were lucky in many ways there as the public health community because we were a part of a civic engagement rebirth, and there was a great deal of thinking about what were the right voices and experiences and who should be there, and a lot of crosstalk and community conversation anyway. But public health, as it can be in many communities, was really weakened, not just by the storm, but by years of decreased funding, some brought on, frankly, because we as a nation have forgotten how valuable public health is, how it is a part of the infrastructure of our country, and have increasingly turned to the tools of medicine as a way to save lives. Great success in this country on using the tools of medicine, vaccinations, drugs, dialysis, surgeries to improve life expectancy. But as some people may know, we've begun to plateau in life expectancy. And just as we took another look in New Orleans at what were the right players that needed to be involved, the country's looking again and saying that there are broader issues at play, and public health is a natural leader in seeing that the conditions in which we live and learn and work and play are healthy, so that becomes the easy choice, but also just that the basic infrastructure is strong. So I was in the midst of rebuilding a part of our infrastructure in the community, and as I said, got very lucky because we had strong leadership not only from our mayor, but from other parts of civic society who recognized that to get to health, we would need that part of our infrastructure to be strong, our health department in particular.
Very interesting. So one way I think of your work at the federal level is as sort of an extension really of that concept of health in all policies. So for people who haven't heard what Public Health 3.0 is, or who have heard it but really aren't sure what it means, can you tell us where we stand and what that concept means?
Public health is undergoing an evolution. It's transforming. This began very organically, not only in communities like New Orleans, where we were rethinking how we were approaching health and with whom we were approaching it, but I've learned that it's happening all across the country. It's the next generation of public health practice. The early days, 1.0, were a time when the epidemiology told us that it was about communicable disease. That was the ways that we needed to support the public's health, sanitation, and vaccinations in that period as examples. But as the epidemiology changed, so did the work and focus of public health to chronic disease, non-communicable disease. And though that work isn't done, we've made a lot of progress in the space of non-communicable disease, clearly, to really tackle more upstream the causes of cardiovascular disease, the leading cause of death. Even injury, if you as you move down the list, it really is going to take a broader approach, and that means taking a health and all policies approach, so working with transportation or housing, but also really being able to lead the conversation and measure the success of addressing the social determinants. So these Public Health 3.0 communities are building on their 1.0 and 2.0 and really expanding their purview, thinking about how they work in a multi-sectoral fashion. And are either at the table or leading at the table where appropriate. We're seeing also that they're considering themselves responsible and accountable to be a chief health strategist on the front lines. This is a term that can apply really to many types of leaders on the front lines, but when the public health leaders begin to see themselves as being strategically responsible, not for executing on programs that are funding, but really leaning in and thinking ahead about the ways that they can broadly create a healthy environment, the conditions in which everyone can be healthy. Those are the communities where they're beginning to see a lot more success and are reversing the course. You know, there's some really nice work by Raj Chetty that looks at more than 1 billion data points of people across this country, and looks at life expectancy and what are the underlying characteristics that predict which communities are healthier. And though public health is not called out in that work specifically, there are a lot of recurrent themes, and it essentially points to the entire community working together to address broad determinants like poverty and education and public infrastructure. And that theme is repeated in these sort of Public Health 3.0 communities, and has given me, frankly, a lot of not just hope but excitement about public health being back as the convener of stature, and being able to have these really important conversations that I think are going to put the trajectory of life expectancy and well-being back on the right track.
So one of CDC's always most important partners is state and local health departments, and many of our Grand Rounds audience work in those kind of settings. What does this idea of Public Health 3.0, what could it mean for them in their day-to-day working lives?
You know, in that we put out a report on Public Health 3.0 that's available at healthypeople.gov, healthypeople2020.gov. So if people want to get more into the weeds about it, we make 5 recommendations essentially about what success looks like, and then hanging off of those are another 46 recommendations. There's 51 in all, but really 5 big ones about leadership and funding and data and accreditation and accountability and partnerships, and then ways that federal, state, and local government, but also the private sector, can work together to create the kind of environment that allows them to be successful. What I heard in the listening tour we did about Public Health 3.0 and what we have been learning from other sources, particularly people working on this on the front lines, is that this is the way they want to work. They want to be able to think broadly about systems and environmental and policy level change. They want to be able to convene and shape health in all policies across government. Sometimes when they're doing that, it's short term or it's not sustainable because the funding they receive tends to be more categorical. Because they may not have the data or the tools to look at the health of their community broadly. Maybe they don't have the right partners. Maybe business isn't at the table with them in as effective way as they want. And maybe even as leaders in public health, and it doesn't have to be the health commissioner or state health officer or secretary. Everybody's a leader in public health. Our education and training experiences haven't always brought us the vocabulary that gives us that comfort that we can talk with the criminal justice system or transportation or the housing sector. So it's also incumbent upon those of us working in public health to continuously learn and retrain, to make certain that when we are having those conversations, we can understand the kinds of decisions that these other sectors are making and help them learn about the downstream consequences. So I do hope people will look at the report, because we took the time also to think about what would be most impactful and would begin to bring this new world of Public Health 3.0 to more communities, but help those that are engaged in it to be successful. Oh, and there's some case studies so people can learn about communities that are doing it and learn from them.
So really a vision of a future in which public health has a leadership role, not just in health, but really in improving society in general.
And well-being. And to paraphrase something that we say sometimes in health information technology, the future is here, it's just not everywhere. And so we found that there are a lot of leading edge communities in Kansas and in Spokane, Washington, and in Tennessee and in the Northeast, Pennsylvania. And they just really need to be supported and to have kind of a framework and be connected to each other so they can keep learning and growing and advancing the movement.
Well, thank you very much for joining us today, Dr. DeSalvo.
Thank you, John.
Please join us next month for Beyond the Data.
So hopefully you enjoyed that video. I think it's a good video to summarize some of the previous slides and looking at Public Health 3.0 and how that impacts us as a local health department at Defiance County Public Health. Okay, the next slide, this shows an updated strategic plan for our agency. Across the top, we can see our vision, which is a healthy and safe Defiance County, followed by our mission statement, which is to promote and protect the health and well-being of all people and places in Defiance County. That mission statement captures social determinants of health when we look at all people and places in Defiance County, really looking at all of the conditions which have a impact on a person's health and in population health for the community. So what I did here is took the 5 recommendations, which are in black text with all of those lines. So these again are the 5 recommendations, and looking at Public Health 3.0, what agencies should invest time and money into in the work that they do. And I'm linking these to our strategic goals. So goals in our strategic plan are to improve community outcomes, ensure financial sustainability, deliver effective services, and to have a capable workforce. So if we look at these recommendations, I can see, and we can see together, that each of these recommendations ties to one or multiple goals that are in our strategic plan. When we did this for Workforce Development Day, to kind of summarize everything, what we did is looked at these recommendations and just asked staff if they've experienced any of these in the last 5 years. We are at Defiance County Public Health looking at our community health improvement plan and our strategic plan, and then even going down to staff individual development plans, looking at how we can integrate these recommendations. It's kind of organic in the way that we do our job. This kind of happens naturally, but it's also helpful to have these recommendations in mind when we're coming up with goals, when we're looking at evaluating programs, looking at these and saying, okay, how can we inject some of these recommendations into the work that we're already doing? So maybe you can look at these recommendations and see if you've experienced any of these yourself, or if you've seen anything that local health departments have done, whether it be our agency or another county health department. Maybe you've seen some of these things, strategic partnerships, maybe health departments working with a library or with farmers markets, or with some private industry to do a vaccine clinic, maybe at a car dealership or something like that. Maybe looking at reports that have been published by local health departments when we're looking at timely, actionable data and metrics, publishing reports, maybe a chronic disease report or a health equity report, dashboards for injury prevention, different things like that not only can we use as a health department, but maybe other agencies could use as well to inform some of the work that they're doing. So that's all I have for this presentation. Hopefully you learned something, and if you did and you'd like to discuss it, please reach out to me. If there's anything that we can do to help you out or help your agency out, maybe it's a nonprofit, maybe it's a private industry and you're looking at partnering, to do something, to improve some conditions in the community, we'd be happy to discuss that. Our phone number's there, as well as my contact information. Feel free to give us a call. You can always email me as well, bheil@defiancecohealth.org. But just look forward to improving things in our community, meeting people, seeing how we can maybe work together to reach some common goals for Defiance County. Thank you.